Next comes our muscle strength examination. So we need to look for the strength of various muscles. The most important muscles to be tested in shoulder are your rotator cuff muscles. So we start with supraspinatus. Supraspinatus can be tested by the Job's empty can test or the full can test. For empty can test, you ask the patient to forward flex in the scapular plane about 30 to 40 degrees and hold it there with thumbs down or in internal rotation. This is the empty can test. You can do it on both the sides. Ask the patient to forward flex against resistance. ऊपर उठाएंगे, जोर लगाएंगे and look for strength. Compare on both the sides. This is your empty can test. A full can test is also described keeping the hand in same position, but instead of thumbs down, it's thumbs up. And then you repeat the same maneuver, forward flexion against resistance. There are pros and cons of both the empty can or the full can. The empty can recruits only the infraspinatus, so it's more specific, said to be more specific. But patients with impingement syndrome can have pain in the empty can position, and that pain can impair your muscle strength testing. A full can recruits both your deltoid and your supraspinatus, but there is no interference of pain due to impingement, so you're just testing your muscle strength. Since deltoid is usually similar on both the sides, it can also be used to test this the strength of supraspinatus. I usually do a full can test. For infraspinatus or external rotation testing, you can do a Pate's maneuver or external rotation. Strength testing asks the patient to take the arm elbow inflection, tuck the arm next to the body or the trunk, and ask the patient to external rotate against resistance. This is the way you test for and look for strength, compare strength on both the sides. This is the Pate's maneuver. You can also do the same thing in abduction. This way also you can, in this position also you can test for the strength of the patient. Of the external rotators. For the internal rotators, specifically or subscapularis, various tests are described. The first one we'll talk about is the belly press sign, the Napoleon Bonaparte sign. In this, you ask the patient to keep the hand, both the hands on the belly, keeping the elbows, try and keeping the elbows forward to the shoulder, press the hand into the belly. If the patient is able to do this with both elbows forward and no flexion at the wrist, no palmar flexion at the wrist, that means the belly press sign is negative or your subscapularis strength is good. Patient with a poor subscapularis will try and compensate the internal rotation by a flexion or palmar flexion at the wrist. You can do a modified belly press test, in which what you do is you ask the patient to keep the elbows forward, keep the hands pressed, and then try and rotate it back into external rotation and compare that strength on both the sides. This is a modified belly press test. Second test for subscapularis would be your Gerber's lift off test. In this, you stand at the back of the patient. Patient is asked to keep his hand at his back, and then patient is asked to lift his hand off his back while you resist this position movement. Again, you looking at the strength, comparing the strength on both the sides. A disadvantage of this test is that a lot of patients with shoulder pathologies would have restricted internal rotation. The patient would not be able to take his hand behind his back. So you won't not be able to do this test. Also, this test is more uh, difficult to do in such situations. So a better and more sensitive and a specific test for subscapularis is a bear hug test. In bear hug test, you ask the patient to forward flex and internal rotate and adduct a bit, and ask the patient to keep his hand almost near his opposite shoulder. Then you ask the patient to keep his elbow stable and push your hand down with his uh, palm, keeping the elbow stable, and you resist this position. So if the patient is internal rotators or subscap are weak, you will be able to take the arm in external rotation. This is a very specific sign for tears of upper one third of subscapularis. Usually the tears of subscapularis start in the upper part of the tendon. So this test can easily detect those tears and the weakness because of those tears. It's important to look for strength of other muscles also. You can look for deltoid muscle strength, which you can look for anterior and middle deltoid. You can look for strength of the abduction, and you can look for strength of posterior deltoid by standing behind the patient, asking the patient to keep the arm in abduction and asking the patient to do an extension maneuver of the पीछे लेके जाना है, ऐसे नहीं, हाँ पीछे पीछे extension maneuver of the shoulder and looking at the bulk and contraction of the posterior deltoid. Examination of muscle testing for shoulder is not complete unless you look for scapular muscle strength, especially your serratus anterior and your middle and lower trapezius. This are demonstrated in a lying down position, which will demonstrate that when we ask the patient to lie down. Examination of shoulder is not complete unless you do an examination of the cervical spine and of the elbow, as the dictum is in shoulder in orthopedic examinations. You always examine a joint proximal and distal to the joint being examined. So do a cervical spine examination, do a elbow examination to look for any pathologies which may be which may mask or which may lead to you to making a wrong diagnosis. Do a neurological examination of the patient. Also look for sensory disturbances or motor weakness distal to the elbows to look for any pathologies coming from the plexus or the cervical spine.